Good afternoon. This is Robert Chisholm from Chisholm, and Kilpatrick. Welcome. We're pleased to present another update on what's happening at the VA regional offices. With us today is E.J. McQuaid from the Providence Regional Office. He's the director of the Providence Regional Office, as well as the acting director of the Hartford Regional Office. Also present is Rachel Furman, and Rachel is the service center manager here in Providence. Also with us is Mark Ramos from the Providence Regional Office. Present at CCK is Brad Henning and Christine Clemens. And without further ado, we have a lot of things to cover today, and we wanted to thank you all for being here today. And EJ, if you could sort of outline in general terms what's happening now at the regional offices. Are they open? How are you all working? If you could update us on that.
Sure. And yeah, Robert, thanks for the opportunity, and the team at CCK. For folks, what we're going to do is I was going to really talk regional office operations. Rachel was going to talk CMP exams, and then Mark was going to talk mail. So we've chunked it out a little bit, really kind of based on subject matter expertise, and of course, a lot evolving in all categories. So I'll start us off and then hand it over to Rachel. But so regional offices are still closed for walk-in traffic. When I say closed, they are open for business. I want to be very, very clear there. Every regional office, for VBA remains open. But for walk-in traffic, we are not seeing walk-in traffic in our public contact or in VR&E, which is where traditionally we see our most, most of our walk-in traffic. This also includes out-based facilities. Any facility aboard usually a military installation is where most of our out-based facilities are aboard. But that would also include, here in Providence, we have we see walk-in traffic at the medical center, the Providence VA Medical Center. Same for the Hartford RO, where I'm the acting director. They have an office at the West Haven Medical Center where they see, walk-in traffic, and those offices remain closed to the public. We are doing other, there's multiple other initiatives to fill in those gaps. And for VR&E, telecounseling is fully operational, and I will, just share with you, we are seeing outstanding results there. COVID-19 has forced some very positive changes for VBA. As difficult as it's been for everybody, and of course, my best wishes to everyone's families and that's listening today or in the future. But certainly for things like VR&E, telecounseling services have proven to be very effective. So I did want to share that. But regional offices remain closed for walk-in traffic, but open for business, where we are still providing all the business line functions. In terms of, what is scheduled for board hearings at the regional offices, so many of these hearings have been postponed. It is we have not had in either Providence or Hartford many hearings that were scheduled. Most that we did have just been postponed, but I know BVA is working diligently for other hearing alternatives, whether voice or video, to supplement. But I really did not have a comprehensive update regarding board hearings. But for any hearing that we had scheduled that couldn't be replaced via a teleconference, it has been postponed. So again, I think that is where BVA is working to get those schedules reassessed, and certainly with BSOs and attorneys as well. The ROs, have we seen an increase in terms of claims for benefits? Certainly, business has not slowed. We have not seen a drop off in claims, and in terms of updates that we're providing as folks are essentially having more time on their hands. We are seeing more inquiries for benefits entitlements. Certainly in VR&E, as this has taken a huge toll on the economy, and many folks are out of work right now, or have been furloughed or laid off, or their businesses have just been so drastically impacted. VR&E services, we have seen an uptick there in both Hartford and Providence in terms of application for VR&E services. And again, a great alternative for qualifying veterans. Loan guarantee and certainly a GI Bill for education type processing, a lot of activity there. We are not a regional processing center for either education or loan guarantee, but I can tell you that both have seen, for refinancing purposes and as well as for GI Bill and all the impacts on the university, are very, very busy right now and still processing claims there. I don't really have great updates on education. There's so much happening right now regarding what's going to be happening with fall semesters and even those graduating high school, things like that. Or I'm sorry, graduating college and whether those are what's going to be happening there. It changes from university to university and college to college, but a lot of activity there. So on the RO side, I wanted to say, VBA right now, much like all federal agencies and cabinet level departments, is starting to have that discussion about what does the way forward look like? How do we start seeing walk-in traffic, veterans that need to come in person while respecting social distancing and the safety of our workforce, as well as veterans. A lot still to be flushed out, but I would say that conversation is happening. But certainly for all claims processing actions, they are still we are still in a maximum telework posture, and there's no set date as to when we would come out of that. What I can share with you, though, is that, in parts of the country that are not considered COVID-19 hotspots, and really, I think you can almost consider all of the Northeast a COVID-19 hotspot. But for parts of the country that don't fall into that criteria, you may see them start seeing walk-in traffic on the sooner side for public contact or VR&E. But in areas like the Northeast, New Orleans, Detroit, Seattle, I think you're still looking at several weeks at the earliest. So I did want to share that. We're still processing claims. We're still providing all the services. We're still here. But in terms of seeing veteran traffic in person at the regional offices, I feel like we're still several weeks away from that, for hotspot type areas. So with that, I wanted to turn over to Rachel for CMP exams, and then we can circle back for any questions that folks have about regional office operations.
All right, so I'm going to be looking off to the left here to make sure I cover all of the questions that you guys had submitted. So in regards to CMP exams, VHA is currently not doing any CMP exams, and neither are the contractors in a full as telehealth site sort of exams, or at least we have not seen any of those as of yet. So right now what we're trying to do is rate off of the evidence of record and putting a re-emphasis back on ACE exams. So you had asked a couple of questions regarding the ACE exams, and there have been some restrictions lifted off of the ACE exams, some minor ones, which have all been updated in the manual reference. So if you need that manual reference on what qualifies for ACE and what doesn't, I can certainly provide that to you guys. So that's the biggest thing right now is the exams are the biggest impact that we have seen in the claims processing aspect with all of this COVID-19. I know thousands and thousands of exams have been impacted. Anything that can be partially rated based on the evidence of record or an ACE exam or getting a medical opinion, we're rating it partially in order to get as many benefits out that we can. For things that require an in-person examination, those are being flashed within our systems with a special code, and they are just suspending in VBMS, NWQ until we are able to get those exams. So those are going to be delayed until we have some solutions regarding either telehealth or ways forward for the in-person exams. I suspect, just like with the public contact, we have areas that are more hot-spotted than others where exams may be impacted, so I wouldn't be surprised if there is more of a phased approach on opening up in-person exam options. Let's see, make sure I had all of the questions on there. So no veterans are going to be penalized. Everything is just kind of hanging out there, again, with a focus on the evidence of record and ACE. the contractors are able to get DBQ information over the phone. So if they need some information from the veteran, they can do that. That's kind of been all we've seen as far as telehealth. It's more like this information is incomplete based on what we have, and they'll call and get some of that information over the phone to get the information completed when possible. Questions on any of that as far as the exam process goes, or anything more specific?
Yeah, Rachel, I have a question actually, and this is something that with the public-facing DBQs or the DBQs that used to be on VA's website having been removed recently, if a veteran, let's say, had been previously scheduled for an examination that due to COVID was canceled, so they know that VA needs those exams to process or adjudicate their claim. If they had access previously to the DBQ, maybe they had downloaded it already, is that something that VA would accept if they had their current treating provider complete?
Yes, absolutely. So we actually just received official guidance on that 2 or 3 days ago, which said we will be accepting any evidence that we received, even though they've been taken down. If they had access to them and private providers were filling them out, we'll take any sort of evidence.
And would that be essentially a way around having to wait through the process of having one of these examinations and going through the process of getting it rescheduled? Would either be to submit a DBQ or a report from one of their treating providers where they know that the examination is going to be essentially needed to complete their claim?
Yes, absolutely. That would be, that was in the question where you had, what advice do you have? That would have been the advice.
Thank you.
You're welcome.
And before we go to mail, I was just going to chime in for a minute, Robert, with, Rachel hit on it with exams being certainly the biggest challenge right now in the COVID-19 environment. But right on the heels of that, too, is also records requests. And, in Providence, we're very proud to be, one of the innovators of how do we improve that records request and leverage technology. But right now there are many appeals, I would say, that are, currently being delayed or waiting for records. And these are records that we would normally be obtaining through the Joint Records Research Center. So we're looking for creative solutions. VAs or VBAs, compensation service business line, I know is working diligently as well to try to come up with solutions there. But of course, those entities, those records research centers have also really been impacted by COVID-19 and don't have the manpower right now providing those services. So really, exams is certainly the biggest challenge right now in regards to any sort of appeal or disability compensation claim. And then right behind that is any sort of, records request activity is also, certainly a hurdle that we're trying to overcome.
So to the extent that we could help veterans get medical records, any other records, and submit them, that would help the process along, it seems.
Absolutely. Absolutely.
And EJ, just for our viewers, when you talk about these records from JZRC, the types of requests that are going there, these are typically things that would be, for example, corroborating stressor events, things that happen in service records. Are those the types of requests, or are there kind of more comprehensive?
I would say that pretty much hits the nail on the head there, Christine, is those type of stressor related verification type things. And again, sometimes those in the form of a DD-214, other times they're in another another record type type action. But really those are the major ones there.
Even just our PIES requests for service verification or STRs have not been able to be fulfilled very quickly at this point.
Every regional office is configured differently, and I can, I've worked at 7 different regional offices, so I can speak to that. And I'll just talk about, Hartford and Providence that I currently have oversight of. Hartford is co-located with a medical center, and Providence, we're in a standalone a federal building with multiple other tenants, although we are, the largest. The fact is, right now, all mail is going to our centralized scanner. And I'm sure folks that are listening to this may be hearing about that anecdotally, or very, saying I have examples where, VSO mail did not reach the VSO, went right to the scanner. that is being, worked out with the VSOs. I will tell you the biggest issue there is more or less checks for the VSOs. And that also includes checks for our private attorneys. We have run into one or two situations already where we are aware of private attorney checks or payments that have been sent to the scanner. And we are working with our headquarters and with the scanning vendor to, get those verifications. And there's, I guess, approximately 3 or 4 centers that are being set up to make sure that any sort of check that was going to a VSO or for a private attorney, that either that somehow we get that payment or get that return to the regional office for action. And then just before I turn it back over to Rachel for what advice we have, just a couple of things I wanted to in terms of deadlines that have been extended. There's none that really jump out to me, Robert, aside from exams. Obviously, any exam that has been postponed for veterans, which is really the more appropriate term than canceled, is that we will be, there's several processes in place so that that's being tracked, whether a contract provider, CMP unit, a VHA CMP unit, so that those exams will be rescheduled for either some type of an in-person or a telehealth exam in the future. So that to me is the biggest deadline in terms of extending that, claims that can be rated without an exam. We are working feverishly to make sure that we do that. But for any claim that does require an exam to include an appeal, those exams will be taking place at some point in the future. We already talked a little about some of the rules and procedures. DBQ is a great one there. And then the only thing I would just add for advice to claimants is, please, VBA is open. We are open for business, all of our business lines. So if there is a question and a benefit that someone is considering applying for, there's no reason why they should delay. Whether that's, compensation, education, loan guarantee, other, we are very much open for business. And Rachel, any advice you wanted to share?
Not so much advice, other than just probably watch out for more changes coming, particularly with communication with veterans. I think we're going to try to explore different technologies and appointments and different ways that we can reach out during this time and moving forward. So that all is yet to be determined, but that's what we're kind of working through in very early stages right now. So as far as the appeals, as far as deadlines and that being extended, well, deadlines haven't been extended. There was a policy letter 20-02 titled Novel Corona COVID Claims and Appeals Processing Guide. So it does apply to claims and it does apply to appeals as well, which is effective as of March 1st, which allows any claimant to request an extension to submit evidence for good cause. And the coronavirus is a good cause reason that has been extended. So if you don't have that letter, would be happy to share that with you. The caveat on that is it is required that there is a request for an extension on the part of the claimant to submit the evidence that we need. So that's the biggest thing that's out there. As far as impact on informal conferences, there has really not been an impact on informal. We're still doing those telephonically and Skype when available. And same with even formal hearings. So we've been given guidance that we are now able to proceed with formal DRO hearings via Skype. So we're doing that as well. And then as EJ and Mark explained, so request for claims folder, like they said, the RMC is very minimally staffed, and it's really pertaining to some of those higher priority groups that they are attempting to expedite requests, such as homeless, soon to be homeless, terminally ill. So those requests are a bit backlogged right now. So it's still the same procedure, but they are going to take some time. I think that covers most of it on here. As far as filing the extension, that can be anything as simple, just a quick note or even a telephone call to the call centers requesting an extension, and we would document that on an 0820 in the system.
Thank you very much. This has been really, really helpful. Brad, do you have any follow-up questions at this point?
The one thing I wanted to ask about, and maybe I missed it when we discussed it earlier, was the postmark issue that they talked about in the Federal Register that VA is accepting.
Yes, so we are accepting the post office postmark as the date of claim at this point, and I believe that's going to continue. I think it said 60 days. Don't quote me on it, but I think it was like 60 days until the COVID thing had expired.
And if there is no postmark, it says that they will consider it to be received no later than February 29th.
Correct.
Okay.
Yep.
Great. Thanks.
Just so you know, faxes are really hard for us right now since we do not have people in the office. It's hard for us to get that because we have to grab the mail and then have it shipped out. So I would recommend using the Postal Service as much as possible.
Okay, so we fax a lot of things to the EIC. Is that a different operation in terms of receiving faxes?
No, I meant faxes just straight to the regional office.
Okay, great. Okay. Listen, we really, I'm going to sum up here. We really want to thank you all for joining us here today and spending some time updating us on what's happening with the regional office. And it's good to see you all, and it's good to see you all working. We really appreciate all the hard work the VA is doing. And so thank you.